I actually did want to ask you something. Scientifically, they say that the screening should start at the age of 21. But in India and in a lot of countries, the age is 30 and above. Because they say women between the age of 21 and 30 will wash off the infection on their own. So when we go to do screening in the field, the directive we get from the government is that 30 years and above women you screen. So what is the evidence of women younger than 30 having cervical cancer and it being an advanced stage or anything like that? Is there any, I mean, we know of Jane Goody and all. She was somebody who passed away at the age of 29 with cervical cancer. But otherwise, what is the incidence of cervical cancer below the age of 30?
Yeah, I mean, in general, we also seen that during 21 to 30, again, it's a sexually active phase of most of the Indian population, say young population. So numbers is very high in this group. At the same time, the resources that we have is very limited, number one. So most of the time, this particular virus is, again, cleared by your immune system, because immunity is really good during this particular phase of life. So that is the reason most of the time we are facing challenge what to do in this particular age group. And specifically, HPV DNA testing is not recommended during this age group, because we all know they will catch this STI infection and it will clear by the body. Number one. Number two, if you look at the other infection that I have mentioned on this last slide, other bacterial or viral infection that equally contributing and damaging the entire vaginal microbiome during this sexually active phase of life, because it's not necessarily that you are exposed to virus during this particular phase of life. And cytology is recommended. Why? Because if there is any other co-infection, not necessarily because of the HPV, then also you'll see some changes at the cytology level. So 21 to 30, strategically, globally also, in India also, according to WHO again, they recommend to go for cytology based testing only. And we are also advocating the same.